I'm Dr. Drew Robertson. I have been speaking about the current healthcare debate and about the realities of physician practice today. No discussion of this topic is complete without a consideration of practice expenses. One of these healthy practices that I'm speaking of today will typically have an operating overhead of about 65%. What that means is that for every $100 that the practice collects, only $35 are available for reinvestment in the practice, for equipment repair, equipment replacement. And only after all of that is paid can the physician pay himself a salary. My own practice, Wellspring Pain Solutions, has a slightly higher operating overhead. It is 70%. I have a highly specialized practice that involves a lot of personnel that allows us to deliver a very high level of care, but all these things do cost money. Consider what this means for practices when we consider reimbursement cuts. I'll use my own practice as an example. Let us say that nationwide we decided to cut physician payments by 5%. It seems like such a reasonable thing to ask. Certainly many businesses routinely find ways to cut their expenses by similar margins. And in our current situation, it might seem reasonable to ask physicians, can we not pay you just 5% less? Can you not help our society with that sacrifice? What that would mean for my practice is that where I'm currently collecting $100, I would collect $95. But no one is proposing a way to help me control my expenses. No government entity, no insurance company is proposing to come in and demand that my employees make 5% less, demand that my utilities go down by 5%, or my lease space goes down by 5%. My costs would remain the same because I'm being asked to do the same amount of work, see the same number of patients. My costs would remain at $70. That amounts to a 16.7% decline in return after operating costs, not a 5% decline. The point of all this is it results in only a trivial saving for the economy as a whole. This would save about 1% of healthcare costs. Only about 20 cents of every dollar spent on healthcare goes to a physician practice. That's a dated figure. It may have shifted some. I doubt that it has shifted much. Well, we've talked about a 5% decline in physician payments. 5% of the 20% is a 1% overall savings. You are asking physician practices to give up 12, 15, 18% of their net for a trivial savings to the healthcare system as a whole. Let's dig a little deeper. Let's talk about the options that are being proposed in Congress now. Certainly some politicians would like to move all physician reimbursement to Medicare rates. I hear politicians denying that currently, but the trend is obvious, and it is clear that there are some policymakers and politicians who would like to see us all working at those rates. The public option would almost certainly be based on Medicare rates. My overall collection rate, the collection rate for my practice, Wellspring Pain Solutions, is 36%. That is, for every $100 we charge, we collect $36. However, our rate for Medicare is much lower. It's only 22%. For every $100 we charge Medicare, we collect only $22. This leads to what I call the public option death spiral. As more and more of us are moved to Medicare rates, going from a 36% collection rate to a 22% collection rate means a 39% decline in revenues. In my case, where I was collecting $100, I would now be collecting $61. But again, I'm being asked to see the same number of patients, do the same amount of work, utilize the same amount of overhead, which is $70. Well, there's a significant mismatch there, and it would put me out of business. I can tell you that many other physician practices would go out of business in such a scenario as well. So we go back to the graph I put up earlier, which shows that currently already 12.2% of practices are in this situation. A very large number of practices would be moved into an unprofitable situation with any decline in reimbursement, particularly the very large declines anticipated in a public option. What becomes of unprofitable doctors? They retire, or they seek other employment. Sometimes that employment is somewhere within the healthcare system. Sometimes it is entirely absent from the healthcare system. In either case, it worsens the shortage of physicians who are actually seeing patients. These physicians often sell their practices to hospitals so that they can continue to treat patients. Because they are unprofitable, the hospitals must then subsidize the practices. But there's no free lunch here. That subsidy has to come from somewhere, and it must mean that hospital costs will rise. The bill has to be paid somewhere. Who wins under current proposals? Not patients and physicians. I find it is largely big insurers, monopoly and oligopoly hospitals, and the government who win under current proposals. Pharmaceutical companies may benefit from current proposals to a lesser extent. Eventually, cost control measures will catch up with them and force them into very difficult straits as well. Overall, though, I want to emphasize once again, patients and physicians are not the principal consideration here. We are allies, and we should not let others divide us.